Did you know that every year, hundreds of thousands of people around the world escape the risk of death by adhering to the golden hour rule in stroke treatment? Stroke is one of the leading causes of death, but timely medical intervention within the first 3 to 4.5 hours after a stroke occurs can significantly reduce brain damage, thereby increasing survival rates and improving recovery outcomes for patients. But how can you recognize the signs of a stroke and act quickly to make the most of the golden hour? This video will provide essential information and detailed guidance to help you and your family respond promptly, protecting health and lives in emergency situations. A stroke, also known as a cerebrovascular accident, is a critical condition that occurs when blood supply to the brain is insufficient, resulting in severe damage and potential threat to life. According to the World Health Organization, WHO, stroke is the leading cause of death and disability globally. In 2019, WHO statistics indicated that over 15 million people suffer a stroke annually, with 5 million fatalities and 5 million more facing severe, lifelong disabilities. However, understanding the golden hour, the optimal time for medical intervention, can greatly increase survival and recovery chances after a stroke. A stroke occurs when the blood flow to the brain is interrupted, causing brain cells to be deprived of oxygen and nutrients. Without enough oxygen, brain cells are rapidly damaged and die. There are two main types of stroke. Ischemic stroke, accounting for approximately 85% of cases. This occurs when a blood vessel leading to the brain is blocked by a blood clot. According to research published in the New England Journal of Medicine, prompt intervention within 4.5 hours with thrombolytic drug alteplase can improve recovery rates by 30% to 40% in patients with ischemic stroke. Hemorrhagic stroke, representing about 15% of cases. This occurs when a blood vessel in the brain ruptures, causing bleeding into the brain. Although less common, this type has a higher mortality rate, especially in older adults or those with pre-existing cardiovascular conditions. Both types of stroke are extremely dangerous and can result in severe complications or death if not treated promptly. The golden hour is a medical term referring to the critical time immediately following a stroke, during which the chance of successful treatment is highest. This period typically lasts from 3 to 4.5 hours after the onset of stroke symptoms. Why is the golden hour important? According to numerous studies, the golden hour is a decisive factor in stroke patient survival because reduces brain damage. The Journal of the American Stroke Association reports that nearly 2 million neurons are damaged or die with every minute treatment is delayed, emphasizing the importance of quickly restoring blood flow to the brain. Improves survival rates. Immediate treatment can reduce mortality risk by up to 30% compared to no treatment or delayed treatment, according to data from the American Heart Association. Increases recovery potential. Patients treated within the golden hour are more likely to recover well and minimize post-stroke complications. A study by the U.S. National Institute of Health shows that patients receiving thrombolytic treatment within the first 3 hours of a stroke have over a 50% higher recovery rate than those treated later. Early recognition of stroke symptoms can save lives and increase recovery chances. Common symptoms can be identified using the FAST rule. Face. One side of the face may droop, the person may be unable to smile, or the mouth may look uneven. This can be quickly tested by asking the person to smile or frown. Arm. The person may not be able to lift both arms at the same time, or one arm may feel weak or droop. Speech. The person may have trouble speaking, may slur words, or be unable to speak clearly. Time. If any of these symptoms appear, call emergency services immediately and note the time symptoms began. According to the American Stroke Center, recognizing fast symptoms and intervening within the first 60 minutes doubles survival rates. Rapid treatment is crucial for helping patients survive and recover from a stroke. Primary treatments include thrombolysis. For ischemic stroke, thrombolytic drugs like alteplase can help dissolve blood clots. Research from the American Medical Association shows that using alteplase within the first 3 hours increases functional recovery rates in stroke patients by 50%. Mechanical thrombectomy. This method can be used if the patient doesn't respond to thrombolytic drugs. Mechanical devices are used to remove the clot and restore blood flow to the brain. A 2015 study indicated that thrombectomy within the first 6 hours improved survival and recovery rates by 60% compared to untreated patients. Hemorrhagic treatment. For hemorrhagic stroke cases, doctors will work to stop the bleeding and control intracranial pressure. Studies have shown that timely stabilization of blood pressure and reduction of brain pressure can significantly decrease the risk of brain damage. Timely treatment not only reduces damage, but also enhances recovery, giving patients a chance to return to normal life more quickly. In addition to prompt recognition and treatment of symptoms, stroke prevention is essential for health protection. Scientific and effective prevention measures include blood pressure control. High blood pressure is a primary cause of stroke. The American Heart Association shows that stable blood pressure control can reduce stroke risk by up to 30%. Patients should regularly check blood pressure and maintain a healthy lifestyle. Weight control and exercise. Being overweight and inactive also increase stroke risk. According to the U.S. Centers for Disease Control and Prevention, CDC, people who maintain an ideal weight and exercise regularly reduce their stroke risk by 27%. Quit smoking and limit alcohol. Smoking and alcohol are major stroke risk factors. A Harvard University study found that quitting smoking and moderate alcohol consumption can reduce stroke risk by nearly 40%. Healthy diet. A diet rich in vegetables, fruits, and fiber, low in unhealthy fats, supports heart health and reduces stroke risk. A WHO report states that the Mediterranean diet, high in olive oil, fish, and nuts, can reduce stroke risk by 20%. Understanding the importance of the golden hour in stroke treatment is key to improving survival and recovery chances. Early recognition of symptoms and timely action are critical for saving lives. Additionally, stroke prevention through lifestyle changes and risk factor management is an important step for each person to protect their health and minimize disease risk.